Thalassemia. Thalassemia is a blood disorder that causes the body to have less hemoglobin, causing anemia and fatigue. It is an inherited disease caused by mutations in the DNA that produces hemoglobin. Since it is an inherited disorder, it is passed from parent to child. It is most common in African Americans and those of Mediterranean and Southeast Asian descent. There are several types of thalassemia. Hemoglobin molecules are made of alpha and beta chains. These chains are the ones that are affected by mutations. These chains are reduced, resulting in alpha or beta thalassemia. In alpha thalassemia, the severity depends on the number of mutated genes that are inherited. The more mutated genes one has, the more severe the disease. If one gene is inherited, there will be no signs and symptoms, but the individual will be a carrier and can pass it down to their children. If 2 genes are mutated, there will be mild symptoms. If 3 genes are mutated, signs and symptoms can be moderate to severe. Inheriting 4 genes is very rare and often results in stillbirth. In an event that the child is born alive with 4 mutated genes, they can be treated with lifelong infusion therapy and stem cell transplant. In beta thalassemia, the severity depends on which part of the hemoglobin molecule is affected. 2 genes are involved in making the beta hemoglobin chain. One is received from both parents. If one gene is mutated, signs and symptoms will be mild and is often referred to as thalassemia minor. With 2 gene mutations, signs and symptoms will be moderate to severe. It is often called thalassemia major or anemia. Most babies born with 2 defective beta hemoglobin are healthy at birth. Signs and symptoms develop within the first 2 years of life. Complications. Those with thalassemia can have too much iron in their body, either due to the disease or from the frequent blood transfusion. When there is too much iron in the body, it can cause damage to the heart, liver, and the endocrine system, including hormone-replacing glands that regulate processes throughout the body. Infections are also common, especially if the spleen has been removed. Complications in severe cases may include bone deformities. Thalassemia can make the bone marrow expand, causing the bones to widen. This can result in abnormal bone structure, especially in the face and the skull. Bone marrow expansion thins the bones, making them more brittle and prone to breakage. Enlarged spleen is another complication. Since thalassemia destroys a large number of red blood cells, the spleen must work harder because the spleen helps the body fight the infection and rids the body of unwanted materials, such as old and damaged cells. When the spleen is enlarged, it can make anemia worse and reduce the life-transfused red blood cell. Slow growth is another complication of anemia, as well as delays in puberty. Heart problems, such as congestive heart failure and abnormal heart rhythm, is often associated with thalassemia. Prevention. Most often, thalassemia cannot be prevented. If a couple with thalassemia or carriers of thalassemia they desire to have children, they should speak to a genetic counselor prior to having children. There is also a form of assisted reproductive technology diagnosis that screens the embryo in the early stages for genetic mutation. This is often combined with in vitro fertilization to help parents who have thalassemia or who are carriers to produce healthy babies. Cure. The only cure for thalassemia currently is stem cell or bone marrow transplant. These plant transplants are not done often as they carry significant risk. The main risk is a graft versus host disease. This disease is life-threatening because the transplanted cells begin to attack other cells in the body. Those with severe thalassemia should weigh the risk and benefits prior to receiving the transplant. Thank you.